I have better news to report today. We are seeing a decrease in our case counts and in our percent positive. I'm going to talk about that, and then I'm going to discuss our reopening plans. Here are the numbers. Since this time yesterday, we've identified 105 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 32,674. Now that 105 represents 3.0% of the more than 3,400 test results that we received since yesterday. And that 3% is lower than the percentage we've seen before, and that's good news. Now, the new cases we're seeing still tend to be younger. More than 50% of those are under the age of 40. Since this time yesterday, we've identified no additional deaths from the coronavirus infection. Our total is 1,735 since the beginning of the epidemic. Now, we'll have to say that sadly, yesterday we learned of 18 deaths from the coronavirus infection in Philadelphia residents, which had occurred over the previous 2 weeks. It often takes us some period of time to identify the deaths. And from the mid-July to mid-August, we did see what looked like a small increase in the number of deaths that occurred, from about 8 per week to about 13 per week over the last few weeks. That increase, I think, is probably a delayed effect of the increase in cases that we saw occurring in late July. And we're hoping that as the case count is coming down now, that we will see the death count coming down in the future as well. That's what's happening in Philadelphia. In the state as a whole, we've seen falling case counts in the past few days. In the United States as a whole, we're seeing case counts that are still high, but that are continuing to fall. Now, back here in Philadelphia, I want to give you an update on where we are with contact tracing. We are continuing to make progress on that. So here's data from last week, 7 days that ended Saturday, August 15th. There were 791 cases that occurred that time that were referred to the contact tracing team. 45 of those were managed by our partner organizations. Of the remaining 749, we reached 69% who then agreed to participate. That's a higher percentage than we've hit before. 4% we were not able to reach because we didn't have a phone, but that percentage is lower than before. 20% we were unable to reach because people didn't pick up the phone. And that's too high, but that's lower than we were before. In the past, it's been about a third. And 4% of people simply refused to cooperate. Of the contacts that those people named when we had those interviews, we reached 79% who then agreed to quarantine. And that's a higher number than we've seen before. So all those numbers are better than we were at before. Now, contact tracing helps us prevent the spread in individual people. It also gives us information about where the epidemic is overall. So here's what we're learning from that process, that most people who know where their infection came from identified it having come from another household member, or then a relative, or social gatherings, including small social gatherings just between relatives and a few friends, or travel, including people that were driving with others without wearing masks. And I do want to point out that when you're driving with someone, you're close by, not a lot of ventilation, and if you're not wearing masks, that is a high-risk situation. So there's a lesson in all that, and that is that the people you trust the most, your relatives and your close friends, are also the ones you're most likely to catch this infection from. Now, you should trust your relatives and you should trust your close friends in general, but not with COVID. They're just as likely to be infected as anybody else. So the message is wear a mask when you're around your relatives and around your friends, including those people you trust. Now, let me give you the update then on reopening. Back in June, we laid out 9 different metrics and targets to track our progress to determine whether it was safe for us to go to green, as the governor laid out the colors initially. We had hoped to meet all of those targets by early July. And turns out we met many of those, but we didn't meet all of them. The most important targets that we did not meet at that time was first the case rate. We said it should be fewer than 80 cases per day, or the percent positive being fewer than 4% if we were testing more people, more than 2,000 per day. Second metric that we didn't meet was we wanted to have a declining trend in our case rates over a 4-week period. And the third was we said within contact tracing, we wanted to be interviewing 70% of the cases. Now, because we didn't meet all of our targets, we went to a modified restricted green in early July. We did not allow some activities that were permitted by the governor. In particular, we did not allow indoor dining at restaurants. We did not allow indoor theaters, and we did not allow outdoor gatherings of more than 50 people. So since then, we have made progress, and we're getting very close to the remaining targets. The percent positive last week was at exactly 4.0%, just at the target we wanted to meet. And the trend in the percent positive has been declining. Starting the week of July 19th, these are the percent positives in those 4 weeks, 5.4% and 4.8%, then 4.1%, and 4.0%. In contact tracing, where our target was to interview 70% of the cases, as I just mentioned, last week we reached 69% of the cases. So we're very, very close. So in hopes that we will have continued progress over the next 2 weeks, we will allow more activities that are permitted by the Commonwealth to restart with restrictions that are similar to those for Pennsylvania as a whole. Now, all this is assuming that there's no significant reversal in the percent positive in the next 2 weeks. We will do this reopening very carefully. And I repeat that. We will do this opening very carefully. It's effective September 8th, the day after Labor Day, and that's to avoid holiday crowds. We don't want to start out with a large number of people in one place in a very high-risk situation. We will retain some restrictions on how things are done. So we will allow indoor theaters to have up to 25 persons. That's what is allowed by the Commonwealth. In there, people will need to wear masks. People must wear masks. And because people must wear masks, no food or drink will be allowed in those indoor theaters. We'll be posting more detailed guidance on theaters either later today or tomorrow. Then indoor dining at restaurants. Because people cannot wear masks while they're eating or drinking, we have to have other restrictions for safety. So the restaurants will have to meet no more than 25% of their capacity. That's consistent with the state regulations. The tables need to be spaced so the diners are at least 6 feet apart from people at other tables. That's also the same rule as with the state. The tables will have to have 4 or fewer seats. And that's to emphasize that this is about people eating with members of their household. We don't want to have a large number of people at a table together from other households. When we have mixing of households where people are not wearing masks and they're close together, that's a high-risk situation. There will be no seating at bars. It's only going to be seating at tables, and no alcohol served except during a meal. These are the state rules, which we also strongly endorse because we know that bars are even higher risk settings than restaurants. So we're allowing restaurants, we are not allowing bars to reopen. The servers must wear face masks and face shields because the servers are the people who are at greatest risk. They're the ones who are going to be coming in proximity to many people over the course of a day who won't be wearing masks. We'll also be encouraging restaurant owners to improve the ventilation in their facilities, such as opening windows and doors or optimizing the settings in their HVAC system. Now, we're asking restaurant managers to take these restrictions very seriously and follow them. That's for the sake of your staff, for the sake of yourself, as well as for the sake of your customers. But in addition to that, we will be enforcing these regulations as much as we can. We'll be sending staff and perhaps volunteers into restaurants to educate restaurant managers about exactly what they need to do. In addition, we'll be sending restaurant inspectors to conduct inspections and looking at these key safety precautions. They'll be doing that proactively, and they'll be doing that in response to complaints. If they find that diners are crowded together or the staff are not wearing masks and not wearing face shields, we will be quick to close restaurants. Now, also, we're asking restaurant owners to promote the exposure notification app that the state announced just the other day. What this app does to remind people is it sends a message to phones that were close by if a person tests positive and then authorizes that notification. There's no names that are passed back and forth, but then people whose phones were close to the phone of someone who was positive will get a message that says that they might have been exposed to COVID and they should take precautions. That app is not available yet, but it's scheduled to be available in early September. And it'll assist us in contact tracing if a case is found on someone who had eaten at a restaurant. So those are the things we're allowing to reopen. For now, indoor gatherings are still capped at 25 persons, and outdoor gatherings are still capped at 50 persons. Now, across all that, I hope you see that there's a key theme here, and that is that our masks are our most important line of defense. If mask use is enforced in a setting, it's much more likely that activities will be safe, and it's much more activity, therefore, we will allow to occur. We need to limit the settings where people are congregating and they're not wearing masks. In the few circumstances where masks can't be worn, like restaurants, we have many other restrictions. So that's the reopening plan, but now we may reverse course if, after reopening, we find that many people are ignoring the safety standards. Or after reopening, we see that there are repeated incidents of spread at restaurants or theaters. Or if we see a substantial increase in the percent of people who test positive, either before September 8th or after September 8th. I also need to put everyone in Philadelphia on notice now that most respiratory viruses, from influenza to cold viruses, tend to get worse in the late fall and winter. Our flu season peaks typically in January and February, but it starts earlier than that. I want to put everyone on notice that we may have more restrictions in the future if our case rates start to rise as the seasons change and the virus starts to behave differently. And to individuals, let me just remind everyone again, there's nothing more important than wearing a mask. It's not hard to do. If you do it when you're around other people, you're going to protect yourself as well as others. And then remind people who are vulnerable medically about this virus. If you're over age 65 or if you have chronic medical conditions, you are at risk. Best to stay home and avoid contact with other people who are out and about unless you're wearing a mask, unless they're wearing a mask. Thanks very much. If you want more information, go to our website, www.phila.gov/COVID.
The question is probably for Dr. Farley. What would happen if after September the 8th, there's an increase in cases and the restaurants have to be delayed in their opening, or there are further restrictions after they've invested money in foodstuffs and their employees are willing and ready to go back to work?
We recognize this is really difficult for restaurateurs because there's so much uncertainty. We would hope that the case counts will go down and stay down, but at some point, if they start to go up, we will have to go back and close restaurants. And we will do that very reluctantly, but if we need to do that for controlling the epidemic, we will do that.
Good afternoon. I have two questions for Dr. Farley. In reference to the theater reopenings, are we talking about movie theaters and performing arts venues there?
Correct.
Both of those. And did you say, and I wasn't sure if I heard you correctly, did you say 25 or fewer people or 25% capacity? And if it's the number of people, how does that make sense as opposed to just doing a percentage of occupancy?
So it's actually falling in line with the state's regulations on this. And the state's regulations, I'm fairly certain, we may need to triple check, is that you have to be below 50% capacity and fewer than 25 persons. So even if you have a giant auditorium, you can put no more than 25 persons inside.
Got it. And my other question for you, Dr. Farley, relates to the restaurant inspections that you mentioned. Are there any plans to step up inspection efforts, just as somebody who sort of regularly goes through the list of inspections and also is out in the city a lot? I've talked to you before about sort of flagrant violations. Given that we're reopening, which could create a more dangerous scenario, do you expect to actually have more inspectors or have more inspectors, have inspectors visiting restaurants more often?
Well, we only have so many inspectors, and we don't know how many restaurants will choose to do indoor dining, but it may be in the thousands. So there's going to be limits to how many we can do. However, what we will be doing is recruiting additional staff that will be going and educating restaurants about what they need to do. And if they spot anything that it does appear to be out of line or inappropriate, then they can pass that information on to an inspector who can then go and do a complaint-based inspection for that restaurant.
Question is for Dr. Farley. Given the fear that many people have had about the reopening, what guarantees can you extend to parents who do need to send their kids to school so that there are no doubts about it?
I can simply say that we have worked closely with the different school systems to have them be as safe as possible. As safe as possible does not mean that there's no risk to having the infection. You can have risk of the infection going anywhere, and even staying home. There's some risk for some people who are going out, and as you learn, the greatest risk is exposure to your relatives. But I can say that we have worked with all the school systems that are having any in-person instruction to have every precaution that we can consider be put in place. And we'll continue that conversation with them. And if it turns out that we're seeing more transmission than we find acceptable, we'll change.
Good afternoon, everybody. So my first question is actually going to be about coronavirus in colleges. So, we've seen college students in other states, become infected and schools have to close down. Are you guys concerned about college students returning, from other states into the city and possibly be, causing further COVID outbreaks? And are you guys, looking at containment efforts, plans to break up parties and the such?
We are definitely concerned about college students passing on that risk. Back in July, we foresaw that we would have a risk here. And so we worked with every college in the city to have them submit plans to us. We reviewed those plans. We gave them changes that they needed to make in those plans and continue that conversation. We addressed risk in a number of particularly risky settings within an overall college or university. There is one that is difficult for the colleges and universities to risk, and that is spontaneously planned social gatherings amongst the college students, whether they're on campus or off campus. We ask them to address them as much as they can, and the colleges all have efforts to do that. We are hoping that they can limit that, and the students will be responsible about that. We'll watch that. If we see a big problem with that, we'll see what other things might need to do to intervene.
So it sounds like it's going to be more up to the individual schools themselves to do that enforcement, right?
Correct. Now, I mean, if the students say they're all going to go to a bar to drink, they'll find they won't be able to do that because the bars are not open. So we do have these other prevention strategies in the community as a whole. But if the students decide to, have a keg and a big party on campus, then it's the responsibility of the college to set some limits on that.
Okay. And then my other question is also about access centers. And Dr. Farley, I know you ran down through some of the, what you guys are doing in terms of trying to make them as safe as possible. But I guess then if we are determining that access centers where they're still at the end of the day congregate settings are going to be available, why not, just in-person instruction, in-person schooling? The health department said that schools could open in Philadelphia if they met certain safety standards that we put out there. And then some school systems in the city chose not to open because of concerns of primarily the part of teachers. But we felt that they could be open with safety standards. So the parochial schools, for the most part, will open. The public schools are not. The charters in general will not. The independents may or may not. And the standards we have for the access centers are very similar to the standards we have for schools.
We've had, there are some restaurant owners who have come out and said that they really wouldn't be comfortable opening indoor dining for quite a while, maybe until there's a vaccine or everything seems past us. Dr. Farley, do you think that is, do you understand that approach, or would you say that it really is safe enough for restaurants to be opening and people to be going to them?
I completely understand restaurants' managers' concern. If you have a group of people together not wearing masks, there is clearly risk there. So some restaurant owners really want to open because they need to bring in, income and employ their staff. Other restaurant owners decide it's not worth the risk. That choice is up to them. We have just tried to say, if you want to open, these are the things you need to do to have it be as safe as possible.
Okay. And then my last question is what, in the case of an outbreak caused by a particular restaurant, what steps would the city take? Would that restaurant need to close if it involved staff and customers getting infected, and how would it be handled?
If we thought that there was, I would imagine if there's an outbreak really associated with the restaurant, they're going to have to close at least some minimum period of time, at least to have a good cleaning. It doesn't need to be a terribly long period of time. The more important thing is to notify those people who might have been exposed to that restaurant, which we would use a combination of methods to do, and that anybody who's been exposed needs to quarantine, and so the restaurant may need to continue to stay closed because they simply don't have any staff who can work.
What penalties will restaurants and workplace be incurring if they do not comply?
Well, we have two tools at our disposal. One is fines and another is closure. We're more inclined to do closure, but we do also issue fines. And we regulate restaurants regularly. And so it's a whole mechanism for issuing fines and enforcing fines and doing closures. And if restaurants don't pay their fines, then if they're closed, they can't reopen.
Thank you. This one's quick. So I may have missed it, but what are the rules for diners themselves when they're going to restaurants? We've already heard the rules about workers, but I'm just curious about diners, what they have to adhere to for masks.
They need to be wearing a mask unless they're sitting at a table eating a meal. Simple as that.
Okay, so they have to walk in with a mask, and I'm guessing walk out with a mask.
Yes.
All right, thank you.
And tip.
Definitely. Thank you, guys.